Hi, I'm Diego,
And I'm Elaine.
and we're going to talk a little bit about sleep today. First, why is sleep important? So it serves two important functions, one of these being cognitive and the other being restorative. And the effectiveness of sleep in total is impacted by four separate factors, these being the amount, the quality, the timing, as well as the state of mind that one is undergoing when they're going to sleep. There are two types of sleep. The first of these is REM, in which most dreams occur, and your eyes move in various directions, as well as your breathing, heart rate, and blood pressure all increased. And REM is shown on this graph with the red swooshes. Next is non-REM sleep, in which breathing, heart rate, and blood pressure all decrease. And it consists of three separate stages. The N1 period is characterized by theta waves of small frequency as well as magnitude. It's a period of drowsiness and transition from being awake to falling asleep, in which muscle activity begins to slow, and there's sudden muscle jerks preceded by falling sensation that the person experiences during this time. Next is the N2 period, which is demonstrated by sleep spindles of small frequency as well as small magnitude, as well as K complexes, which are waves of enormous magnitude. The N2 period is a period of light sleep in which heart rate, body temperature, and eye movement all decrease. Finally, there's N3, or slow wave sleep, which is characterized by delta waves. In slow wave sleep, blood pressure, breathing, body temperature, mobility, and muscle activity all decrease. It's extremely difficult for somebody to be awoken from this stage. Oftentimes, somebody may feel groggy for up to a few minutes once they are awoken. Next, we're going to talk about a couple of the common sleep disorders. First is obstructive sleep apnea, which is a condition in which something blocks part or all of your airway during sleep. One who is experiencing obstructive sleep apnea, their breath can become very shallow or even stop when they are asleep. And they wake up for a moment to reopen the airway and to start to breathe again with a gasp, snort, or body jerk. However, when they do so, they oftentimes do not remember, even though it happens dozens of times every hour. And obstructive sleep apnea can be aggravated or can be caused by both obesity and general health problems. And it's demonstrated in the morning by morning dry mouth, sore throat, or even a headache. Next is narcolepsy, which is characterized by excessive and uncontrollable daytime sleepiness. When one has narcolepsy, they may fall asleep at any time or during any sort of activity. And when they go to sleep, they go almost immediately into REM sleep, and oftentimes even when they're awake. Type 1 narcolepsy comes with the sudden loss of ability to control your muscles, called cataplexy. Type 2 narcolepsy is narcolepsy without cataplexy. When one is experiencing narcolepsy, they initially can experience vivid and frightening hallucinations, and this is oftentimes a part of their daily life. Next is insomnia, which is a condition which is characterized by one having trouble falling or staying asleep. Acute insomnia lasts from 1 week to a few weeks. However, chronic insomnia happens at least 3 nights a week for 3 months or more. Within this type of insomnia, there are two types. Primary insomnia is not linked to any other health condition or any health problem. It can be caused by stress, noise, light, or temperature, and changes to sleep schedule. However, secondary insomnia is linked to a health condition, pain medication, or some sort of substance use. Next are night terrors, which are episodes of few minutes of crying, screaming, thrashing, or generalized fear that a child experiences during sleep. These episodes are repetitive. They're typically experienced by children from 3 to 12 years old, and they happen during non-REM sleep, which usually occurs around 90 minutes after a child falls asleep. They're different from common nightmares in the way that they occur during REM sleep. Oftentimes, when one is experiencing a night terror, they cannot be woken during the episode, as opposed to nightmares. Additionally, during night terrors, oftentimes a child will not remember the episode afterwards, also making it a contrast from nightmares, which a child normally can remember and can be woken during that particular episode. Next, we're going to cover sleepwalking and sleep talking. Sleepwalking is a condition in which a person appears to be awake, but they're truly in a deep sleep. And because they remain in this deep sleep throughout the entirety of the episode, they may be difficult or even impossible to awaken. Sleep talking is a related condition in which an individual vocalizes or speaks in their sleep from few words to full conversations. When that person speaks, they often do not make any sense. and they don't have any little or no memory after the event of this event occurring. It's usually aggravated or brought upon by being sleep deprived or being on a chaotic sleep schedule. And both of these can have episodes that last up to a few minutes, but can even go even longer.
Thank you, Diego. So I wanted to wrap up our topic on parasomnias with a myth that you should not wake up a sleepwalker because it is dangerous for them. And I would like to say that this is false because it's usually dangerous for the person who wakes up the sleepwalker, because when you're in this very deep sleep, the person who is sleepwalking may not be able to measure their strengths and thus cause some type of danger to the person who is waking them up. I wanted to continue with some other myths about sleep. First, snoring. So when one sleeps normally, one does so by breathing through the nose. So when you breathe through your mouth, something's going on already. And when you're snoring, it's when you have a type of obstruction that is causing you to not receive enough oxygen to your brain. And thus, snoring is not a normal thing to do when you're sleeping. And if you do, you should get it checked out. Also with naps. Naps are a good thing to do during the day to replenish your energies. However, fractioning your sleep in separate naps, it does not have the same effect as sleeping for 7 to 9 hours straight, and it's not equal. For all-nighters, pulling an all-nighter the night before a test does not help you do better in it. In fact, it will usually make you do worse, just because even though you can cover much more topic because you have more time to study, your sleep deprivation will affect you negatively and your outcomes on the test. Some other common myths about sleep are, for example, sleeping like a baby. You think you would like to sleep like a baby, but actually you don't. Just because babies do sleep very, very deeply, but they sleep they have a very fractionated sleep. So it is not the common pattern one should follow. You should usually want to have a transition among deep sleep and then like a medium sleep, which is the light sleep, and then a wake stage, unlike babies. Also, sleep time reduces with age. This is false because usually there are some time ranges that change between childhood, adolescence, and adulthood, but after adulthood, you already established how much sleep you need. So it wouldn't change unless it's because of a sleep disorder as you age. Finally, with the biological clock, what I wanted to add was more of a fun fact, which is that our biological clock does not last exactly 24 hours. In fact, it lasts a bit more than that. So every day, our biological clock shifts a little bit later. Also, with biological clocks, it may be normal to think that the normal thing to do is or regular thing to do is to just be awake during daytime and be asleep during nighttime, but there are other types of biological clocks, and that's why we have different types of, and we have these labels, for example, for early birds and night owls. So a bit on factors affecting sleep quality. I wanted to start with the circadian rhythm and how light affects it. So the circadian rhythm is located in our brain, and it's in charge of setting our sleep cycle. And it's mostly affected by light. So it's normal to feel more awake when our eye sense light, and being exposed to light later on in the evening provokes us to sleep later. So being exposed to light during the night also affects our sleep and our biological clock, and it can impact the ability of going back to sleep. This can also be seen through jet lag, daylight savings, and shift workers when our biological clocks are a bit shifted, and it takes more than one day for our bodies to get used to this new time zone or this new time difference. So I want to talk a bit about the loop that is created between physical and mental health, just because it's very important in sleep quality. So physical pain can limit amount and quality of sleep, and can therefore affect your mood, and can have an impact on stress, anxiety, and depression. And these can in turn make you have a harder time falling asleep and having a less quality of sleep and less time of deep sleep, and that therefore also impacts your quality. So it's just like a loop that we should be mindful of, because we need it's important to maintain mental as well as physical health in order to have a good quality of sleep. So finally, the effect of caffeine. I wanted to show this picture because it shows how adenosine and caffeine have very similar structures, and therefore they can occupy the same type of receptor, which is the adenosine receptor. The only difference is that adenosine is something that makes us feel sleepy. So when caffeine is occupying these receptors, adenosine cannot join and be part of the receptor, and it cannot make us feel sleepy. So yes, caffeine helps us stay awake, but if you ingest caffeine later during the night, it will not help you fall asleep. It will do quite the opposite, and it will affect your whole sleep schedule. A bit on reluctance and its effects on sleep. So many people tend to feel reluctance about admitting that they have a sleep disorder or that they need more sleep. And this could be seen as not wanting to get a sleep test, not wanting to use a machine or a type of treatment to help with sleep disorders, or simply not admitting that you're sleepy or that you're tired. And this could be traduced into a sleep debt. So sleep debt is when you're getting less sleep than you should, and basically it's when the need for sleep is more than the sleep you're getting. There are certain impacts of sleep debt, for example, reducing your ability to concentrate, productivity levels, academic performance, and memory. They're all impacted in a negative way, but it can have also other dangers. So when you're drowsy, you can fall asleep at any moment. This means that you can even fall asleep when you're driving. And many motor vehicle accidents caused in the US are due to involve a drowsy driver. This can also be related, sleep deprivation can also be related to suicide in adolescents, weakening of your immune system, which makes you vulnerable to getting sick, and even having an impulsive behavior that can lead you to make dangerous decisions. Which is why I wanted to finish off with drowsiness is red alert, which is our class motto, and it emphasizes the importance of recuperating from sleep debt and preventing it as much as possible in the future. And the most important thing to acknowledge is that sleep is very important. And this motto is so important in our class that, in fact, we're encouraged to fall asleep if we feel sleep deprived, just to replenish our energies and fix our sleep schedule. Thank you. Diego?
Drowsiness is red alert.